So our presenter for today is Dr. Kelly. He is a licensed clinical psychologist and the Director of Clinical Services here at Westside Regional Center. Welcome, Dr. Kelly.
Thank you, Sandy, and welcome everyone. Very happy to have everyone so we can address POS and kind of look at some of the things that are happening with our disparity statistics, and also look at Westside's plan and the department's plan moving forward. Today we're going to be talking about data limitations, overview of the people that we support, services we provide, looking at disparities in services, and also finally looking at our plan to increase equity in service access. All right, so first, some of the data limitations. So there's been a number of changes, obviously, in service delivery, billing, in response to COVID-19 pandemic, and may have affected individuals and communities differently. So when we're looking at fiscal year 2020-21 compared with fiscal year 2019-2020, there's going to be some very stark differences in some of the data just in general. In response to the pandemic, varied individual needs and circumstances, billings for some services changed to a monthly rate instead of an hourly or daily rate. And as a result, this may have reduced differences among individuals in the number of service authorizations, expenditures, and utilization. So the data that we're going to review is reported from fiscal year going from July 1st, 2020 through June 30th, 2021. And that being said, the Regional Center is still making some payments for some back billing for services, so this can go up until June of 2023. So data that we're going to be reviewing and looking at represents the cost of the services that clients have received that have been paid for by the Regional Center. So this does not include Medi-Cal services, private health insurance, special education, Social Security, or in-home support services. Payments made to a service provider under a contract for group services are not also going to be included in this data. Some examples, for example, are crisis support. If you have crisis support, that data and those cost expenditures won't be reflected in the data because that's what we call a group contract. And some individuals are counted regardless of their current status with the Regional Center. So children that may have been found not eligible for ongoing services after 3, we may still see some of those statistics. Individuals that have passed away, they're still going to show up in some of the data that we're going to be talking about. Individuals that have been transferred, or individuals that are currently not active Regional Center clients, if at any point during the year they were a status 2, what we consider like eligible Regional Center clients, they would have captured a screenshot of that, but it may not have reflected the over the whole year. So there are many clients also that have more than one diagnosis. Therefore, when we talk about our population, it may not be totally reflective of the census, or it may seem a lot larger. Therefore, the sum of the clients reported in all the categories may not add up to the total number of clients served by the Regional Center. So, for example, a client who has a diagnosis of autism spectrum disorder and epilepsy will be counted in both those categories. So first, let's take a look at the people that we support. We're going to look at individuals by their diagnosis, age range, race or ethnicity, primary language, as well as residence type. All right, so Westside Regional Center currently has about 123 service coordinators. Fortunately, that number is increasing by the day. We serve over 10,000 clients, almost 11,000 clients, and we're located in Los Angeles County. Looking by different diagnostic categories. So we have approximately a little over 4,000 clients on the autism spectrum, identified with autism spectrum disorder. Almost 4,000 clients identified with an intellectual disability, almost 200 clients with cerebral palsy, a little over 100 with epilepsy, and a little over 400 with Category 5. And Category 5, for individuals that don't know, it's a condition similar to an intellectual disability. So these individuals may, for example, not meet the diagnostic criteria specifically on testing for an intellectual disability, but they have a lot of, they may be like borderline intellectual functioning. They may have some deficits, and subsequently they are require a lot of the same supports and are very similar in their needs to somebody with an intellectual disability. So in our ages 0 to 2, our early start programming, we have 2,091. In our children and adolescent and young adult, we have 4,900, almost 5,000 individuals. And we have almost 4,000 in our adult services or ages 22 and above. So our largest age group right now is from those from 3 to 21. Looking at clients by ethnicity or race, we have 10 that would be in a Native American, 500 Asian, 2,378 African American Black individuals we support, 3,008 Hispanic. We have 12 12 in other category, and 1,500 in this other category. We have 2,737 Caucasian. Primary languages, we have almost 9,000, so 8,900 predominantly English speaking, but we also support almost 2,000 individuals who report speaking primarily Spanish. And a language that is quickly growing in our catchment is Farsi speaking individuals. We have 54, and then we have 110 identifying as other languages. All right, let's look at individuals supported by residence type. So the largest number of the individuals we support are in homes of parents or guardians. So we have over 9,000 individuals living in their primary home with their family. And then next we have 956 who are living independently or with supported living services, 430 in a community care facility, 384 in a foster home, 112 that are receiving continuous nursing or in an intensive care facility. And then we have some other housing types. We have about 79 individuals in that. So our largest in homes of parents and guardians, followed by those with independent or supported living. All right, so some of the services that we provide. So looking at commonly used terminology and the dollar amount of services expended per person, we're going to look at it by race, by age range, and also by residence type. So some commonly used, we have a lot of acronyms in the system. POS is commonly a term used. What that means is just purchase of service. FY or fiscal year is the 1 year period chosen by a company. For the regional center, again, it's from July 1st through June 30th is our fiscal year to report to financial information. Authorized services, these are actually services that have just been authorized to be funded by the regional center. So we have an authorization in place. It doesn't necessarily mean that those services are being used. It just means that they're authorized for use. Expenditure represents that a payment has been made to purchase those services, so that those services have actually been utilized. Per capita, so the average per person, sort of divided out. And finally, we're looking at utilization, so that people using those services that are available to them that we have authorizations for. All right, so looking at the different categories, we can see that we have probably, and another data limitation that we have to look at. So we're going to look at, like, for example, those in the first category. In the Native American, we have a high number of services. We have to recognize this is a very small percentage of our population. We only have, I forget the actual statistic, but less than about 50 people in this category. But that being said, so authorized services is about 82,000. And those services, so those are the services that authorized, those that are actually expended, 66,000. So this is one of our largest categories. In Asian American, we have 32,000 being authorized, and the blue is the authorization, red is being the actual expended services. And let's see, we've got African American, we have authorized services 41,000, expended 32,000, Hispanic 25, 18. So if we're looking, we can see there's obviously different amounts being spent in each category. Probably our largest expenditures with the first category, and then also in the Caucasians, we have about 47,000 that are authorized, 34,000. So looking at some of the disparities and kind of breaking it down, we can see that there's, the white and the Caucasian families were definitely spending somewhat more, followed by the African American, and then followed by Hispanic. So looking at the amount of services that we've expended for that population, and also with some of the other categories, there's some definite deficits in some of the comparisons if we look across the board. All right, so looking across ages. So in red, what we have is the 0 to 2. In green, we have ages 3 to 21. Remember, that's our largest percentage of our population. And then our adult population, our second largest, is in blue. So then if we're looking at, again, our highest expenditures in the first category, we have about 121,000 being spent in the age 22 plus, followed by our Caucasian category, we're about 67,000. And I'm just looking right now, kind of comparing across different age groups, looking at those 22 and above. And then followed by Black and African American, Asian, Hispanic, and then some of the other categories. And so we can see that probably our biggest kind of disparity in service authorizations and expenditures are with the are in the adult group in the ages 22 plus. Then when we get to ages 3 to 21, we see a little bit more similarity, but still some discrepancy and some differences. We're looking at for example, with African American, we're spending per capita about 14,000 per individual, whereas with Hispanic, we're spending about 10,000. With Caucasians, also about 14,000, and with those that are in the and let me clarify, the NH and OPI, we have a lot of acronyms. So Native Hawaiian and other Pacific Islander, we're spending about 10,000. In some of the other categories, 11,000. So it's a little bit similar here, but we can see that we're spending, if we're looking at sort of a largest population group, we're spending per capita on this sort of mid-age and the child to young adult, with African American, followed by Caucasian, and then followed by Hispanic and our Pacific Islander population. So now we're looking at dollar amount of services authorized and expended by residence type. So looking at the numbers that are probably our largest amount of authorization expenditures is in community care facilities, spending per capita about $162,000 for those individuals requiring community care. And so that's those living in like kind of residential homes requiring a good deal of support within the residence and 24-hour care. Followed by, we're spending about $119,000 that are authorized expenditures and $96,000 in expended in foster home placements and foster homes for adults. Significantly less in foster home placements for children. You can see about $7,000 as compared to $119,000 for adults. And then our other category, sort of our and our second largest population, with aside from home, is independent. Those in independent living and required support and living services were authorized 93,000, and we are spending about or expending about 80,000 for that group. And then we look at those at home, which again is our largest population, about 20,000 per individual, and 15,000 that are actually expended. So the difference again between those services that are authorized versus those that are actually, we have actual expenditures and utilization. Service disparity. So this is always a telling number. We're looking at number of people without services and trying to talk about what are some reasons why there may be some of these disparities. All right, so at Westside Regional Center, people with or without services, about 83% of our population, or about 9,000 individuals, are currently receiving services. That being said, we still have almost 2,000 people, or 17% of our population, that's only receiving case management and not receiving any actual services. So fortunately, we're doing a tad better, but we can see that just an issue for Westside Regional Center. This is a statewide issue. On whole, with the statewide, about 81% of folks are receiving some type of service, whereas about 19% of individuals across the state and all the other regional centers not receiving services. So this is a problem throughout the system that we can see. So breaking it down, looking at people without services by ethnicity or race, we can see our largest population, Hispanic families. We're about 20% of our Hispanic families in that group that are not receiving services, followed by those in kind of this other category. And we've got about 42% of Pacific Islanders, and 20% of Native Americans, as 17% of Asians, 14% of African American families. So kind of our largest demographic, which is the largest demographic at Westside Regional Center, not receiving services, in that group is Hispanic families. And compare that, looking at statewide, we can see that this is very similar to what the statewide pattern is, where we have, again, sort of the leading demographic is Hispanic families, followed by Pacific Islanders and Caucasian, African American, and Asian. But again, very similar statistic if you look at the numbers with Westside Regional Center and we compare it and look at statewide, that we have a number of Hispanic families not getting involved. But we also have a large percentage of other groups not being supported. And anybody not receiving a service, I mean, this is something that we really have to look at. It's like, why aren't folks receiving services, and what can be done to kind of engage them in our service delivery model. So barriers to equitable access to services. One thing we definitely have to talk about in this last fiscal year, obviously, is the effects of the COVID-19 pandemic. So trends that we saw, that a lot of families, individuals were less likely to use out-of-home services. So including day programs, social skills, tailored day services. Although they were offered through an alternative services delivery model, there was not the same attendance, and the rates that were paid for alternative service delivery models weren't always the same. Also, what we saw is individuals used fewer independent living and supported living services. So there was some resistance to work with individuals outside of their home. So to have somebody, supported living provider, independent living provider, come into your home, a lot of people, as you know, we've been kind of forming different bubbles. There was a lot of reticence to kind of bring out of family, into the home. And in addition, there was significant staffing issues. We had a lot of difficulties where a lot of service providers that had previously been working in the field also had chosen to stay home. And obviously, everybody trying to protect themselves during the pandemic. So we've collected a lot of feedback. We're looking at different things. One thing we're looking at our intake and eligibility process, and particularly because we've seen significant declines in the number of intake and eligibility during the pandemic in both our early start and our over 3. So some of the feedback that we received from the community is that there's difficulties in accessing assessment, evaluation services, and traditionally the intake application has been a sort of paper pencil process in which individuals have had to drop the materials off in person at our receptionist desk, delivered by mail, emailed, and this has resulted in unnecessary time delays, having the application received and being processed. Things that we've heard: email wasn't received, the mail did not come in. Obviously, the agency has been closed to the public for a while, so it's been more difficult to kind of drop off evaluation intake applications. Other feedback that we've gotten from the community, there's a lot of information. Incoming families, new adult clients often feel overwhelmed by the amount of information provided to them by various professionals that have been working with them during the intake process, and also by their assigned service coordinator. As you can imagine, when you're first coming into a regional center system, you're first going through evaluation and assessment process, being identified, diagnosed with a developmental disability. I mean, these in and of itself is very trying times. There's a lot of information, a lot to process. And in addition, you're really trying to learn to navigate a completely new service delivery model. So some of the requests we've had for online learning library, specifically since we've been more virtual, where individuals can kind of learn things as they go at their own pace, rather than relying on that one meeting that they have with an individual, is having information readily available, and that it seems that one of the more popular methods of getting information these days has been online. Other concerns that have been raised in the community that households are not able to afford. So those that do want to receive online services, that they've not been able to afford a laptop, a tablet, pay for internet access, or have other technical difficulties accessing virtual services or online resources. Households are also requiring assistance in learning how to use this technology or how to look at online services or receive services virtually. Another common concern, and this is not just Westside, this has been statewide, is caseload ratios, is looking at staffing, the amount of individuals that each service coordinator has. Westside Regional Center has been understaffed, traditionally requires additional employees to reduce the number of cases per service coordinator. For individuals enrolled on the community-based services waiver, the caseload ratio in March reported was averaged about 1 in 75, whereas the required caseload ratio is supposed to be about 1 in 62. So obviously, service coordinators having to support more families, there's going to be more barriers to being able to access an individual and kind of receive timely communication. Individuals served who are older than the age of 3 and who are not on the home and community-based services waiver, the caseload ratio is averaged about 1 in 75, whereas the required caseload ratio should be somewhere about 1 in 66. Westside Regional Center recognizes the large number of cases that our service coordinators manage directly affect their ability to better serve diverse communities and meet their unique needs set. Other barriers: purchase to service policy. Common concern identified is that many concurrent services available at the regional center do not meet the particular needs of the individual or their family. Many families have identified services they want, but that have not really been accessible, such as camps, camping, social recreational activities, educational services and supports for children ages 3 to 17, and also non-medical therapies such as specialized recreation, art, dance, and music therapies. All right, so what are we going to do about it? Plan to increase. What are we going to do about disparity and plans to increase equity? So now we're going to look at and review is Westside Regional Center's plan to promote equity and reduce disparities for 2022. So one thing, looking at some of the difficulties and challenges that we've had with our intake system is really completely revamping our system. Through a grant through the Help Me Grow Los Angeles Pathways from First 5 LA, is that we're working on developing an online portal. So this will allow individuals, families, caregivers, service providers to complete and submit an intake application online through our website. In addition, and people have probably seen this, a QR code, like if you go to the restaurant and you want to pull up a menu, you can just put your phone and scan it. Our idea would be that these would be right up front when you enter our office. These would be in pediatricians' offices, doctors' offices. The school district would have access to them. So you could quickly just pull up our online application, and we're trying to make it as user-friendly and easily and accessible as possible so that we get your application as soon as it's submitted, and then it's time-stamped. Applications for both early intervention and Lanterman services will be received through our intake portal. Individuals will also be able to log into this portal so that they'll be able to securely upload any additional documents. They'll be able to communicate with the intake staff, check on the status of their application, and also will have to be able to review upcoming intake appointments on a calendar. Westside Regional Center is also working with our partners with Westside Family Resource and Empowerment Center and the Achievable Health Center to provide families with access to community services and resources that may be identified during the intake process. Recognizing that not everybody is going to be able to access things online, or that there may be difficulties, we have contracted with a vendor with EmpowerTech, and in order to increase the access to remote and virtual services by providing eligible participants with tablets and or laptops, data service, and technical support. We've secured a number of electronic devices which will be provided to families through a lending library if they face difficulties or challenges accessing online services, or need training, need some sort of orientation to using those devices, and in completing the application for services. In addition, EmpowerTech has staff that will be available to support individuals in resolving difficulties with using or accessing these online resources. So we're looking at those being available for request by the end of this, next month. We're at the end of March, but the end of April 2022, up and running so that we'll be able to support families that may have technological difficulties. So some of the other things we recognize, there's a recognition that we don't have enough staff, and looking at the caseload ratios. Good news is Westside is currently recruiting 16 new service coordinators to meet these caseload ratio requirements. This will allow Westside Regional Center to keep caseload smaller and small enough to safely serve people and allow service coordinators the time to carry out some of the other duties, in addition, such as not only accessing our services and supports and explaining, but also some of the generic community services, such as in-home support services, CalFresh, Social Security, etc. Also would allow them more time to attend IEP meetings and complete further professional development. The Department of Developmental Services has expressed a commitment to providing continual funding for the hiring of service coordinators to ensure that regional centers comply with statewide caseload ratio requirements.
Dr. Kelly, we do have a question in the chat. Do you want to go ahead and answer that now, or do you want to wait until the end?
Sure, I'll take it, Stephen.
Okay, what are the requirements to be considered an eligible participant for borrowing technology or equipment?
What we would be looking at is sort of the same requirements that we have with, that individuals may be recognized as like requiring, we would look at basically family income. And so once upon a time, for example, in early start services, we had to look at family income to determine qualification eligibility for certain services. So we would be using some of those same metrics. But I think in this respect, we don't have specific funding requirements. We would be kind of looking at the need. So evaluating on the case by case, quite honestly, and looking at what the need is, and trying to, for those families that really are in need, I think we're going to make exceptions and be willing to try to help support families. But good question. So the other thing that is new and is great coming from we have new funding for positions for participant choice specialists. So we'll be hiring 3 participant choice specialists. These individuals will help to ensure equitable access to services through our self-determination program. This will include education, support to families, and service coordinators to ensure that there's a more comprehensive understanding of the service access model. Another great thing that's happened that folks are probably aware about when it was effective on July 1st, 2021, is that the changes in the welfare and institution codes restored regional center authority to fund camping services, associated travel expenses, social recreational activities, educational services for children 3 to 7, and non-medical therapies, including but not limited to specialized recreation, art, dance, and music therapy. So this has been, we know a lot of families have requested this. A lot of families have expressed interest throughout the years, and finally we're able to do that. And what we're doing right now is really a community outreach to try to get as many social recreational programs as we can vendored and set up to be able to provide those supports and services to families.
I apologize. We had another question come in about the devices. How many devices are available?
Right now, I believe we've got about 25 devices. But I could be speaking. I have to check because the number keeps changing because we keep receiving new ones. But the last I checked, I believe it was somewhere about 25.
Thank you. I'm not seeing any more questions come in at the moment.
So, like I was saying, we've been reaching out to community providers, trying to add them to our list of our vendored providers. So we've been working to expedite our vendorization process, make it easier for these providers to become vendored with us, to be able to pay for these services for individual. I'm going to kind of reach out to everybody here. What we're currently seeking is programs in areas such as camps, tutoring services, recreational programs, swimming, gymnastics, martial arts, and other sports programs. So we need your help. Please assist us by referring any service providers in your community that are not currently vendored with the Regional Center to submit a letter of interest to our Community Services Department. And you can see, so we have on our website that you can submit documents, restoredservices@westsidrc.org. And we're trying to get as many different services vendored under these social recreational programs as we can. Other thing that we recognize that people were asking is information. Like I had mentioned before, one of the barriers and challenges to service access is really understanding the overwhelming amount of information. So what we've done, we have a family welcome experience for new and existing families. So we have an online training program that has 3 courses. We cover early start program, birth to 36 months, school-aged youth, 3 to 22, and our adults, 23 and older. And on this training, we do a general introduction to Westside Regional Center and discuss various services and supports, talk about advocacy, talk about our Family Resource and Empowerment Center, and also discuss different generic and community-based resources that folks might want to consider and that could be very useful. It's available in English, and currently we're translating that, so it's also available in Spanish, and hopefully should be available by the end of next month. Currently, we have almost 300. We have a little over 260, almost 300 families currently enrolled, and we have a link online on our website. We have also, if anybody's ever visited, we have Westside Regional Center has our own YouTubes. So training content, information that we have, we always put it up there. So if families want additional information about different resources, advocacy, appeal rights, we have a whole bunch of different information that's currently available. And right when somebody starts with Westside, we immediately give them the online family welcome experience.
Dr. Kelly, we have a couple of more questions that have come in.
Well, it's perfect timing and a good segue, because now what we want to hear from various folks that have questions. So right now, let's bring it in.
Okay. The first question that came in is, increase of service coordinators in social and recreational programs benefit all families, right? And the follow-up to that is, what will be done specifically for Latino and Black families?
Well, specifically, I mean, one of the things that we've heard that's been a challenge for a lot of folks in different communities is that we may have providers, but we don't have providers in all communities. So we've heard from some African American families that in some of their communities, some of the providers are not there nearby in their neighborhood. Similarly with many Hispanic families. So what we're looking at and trying to do outreach is to those various communities that we know where they are underserved, we don't have as many providers identified, and trying to recruit providers in those areas. So for example, trying to find local swimming programs, gymnastics programs that would be immediate support for those families in those communities. And, again, I really urge everybody, I mean, if you're in a community, you recognize that there are not a lot of local supports, is really trying to encourage people to reach out to us, or identifying them to us, letting your service coordinator know a different service that you might want to access for social recreation therapy that we've not identified, so that we can reach out to them and try to see about getting them vended.
And the next question, I don't know if you want to answer this or if you want me to go ahead and answer it, because I think I can probably answer this best, is the letter invitation for the meeting was sent today, an hour ago. Can you please do another meeting so more people can attend after 5 p.m.? Can you share the presentation in English and Spanish to everyone? The notification, I believe, was sent out about 30 days ago. I did send out a reminder an hour ago just to remind folks of the meeting today, just so that folks would get a chance if they didn't see that original email. The meeting was also posted on our website about a month ago. Tom, did you want to answer the question about it, sharing the presentation again?
No, but I mean, I would just take that. I think one of the things that, and Stephen, maybe you can help me out with this. Once upon a time, we were doing a community newsletter that went out about events. Are we still doing that?
I have started that up again, yes.
Fantastic. So that's one thing that we're doing, and people should be looking for is our community bulletin, which really shows different meetings, different things. But we do have listed on Facebook, on social media, and our website, different events that are happening, including this one.
And it looks like we have a question in the chat in Spanish.
Okay. All right, Stephen. So we have our homework for us. So I think we're hearing that, and one of the things that I would say is that we would be trying to send out regularly, like a community newsletter, and we'd ask everybody to make sure that they're subscribed to that, because I think that's probably going to be a good way going forward. But certainly is trying to get the information out in as many different forms as possible. So we really appreciate that feedback.
Yeah, and the email that you just received was a reminder. You should have received another one approximately 30 days ago.
And if you didn't, so Stephen, if somebody didn't receive that, is it possible like their email address is not updated in our system? I mean, what would be the reason that maybe they didn't get that?
It could have been. I have been having some difficulties with the with our service that we've been using to send out mass emails. I am checking into that. I have found a couple of emails that didn't get to everybody that it was supposed to have, but I am looking into that.
Well, one of the other things that we also recognize, from time is that, and it could be is that we don't have a current email, or that the email that we have registered is actually, outdated, or we've just inputted it wrong. So I would encourage everybody just to clarify, we can look in our system, make sure that the email that we have for you, that we have an email for you that's current and that it's accurate.
And it looks like there was a follow-up there in Spanish.
Okay. And just a question. So how did you get the announcement? Was that announcement emailed, or how did they get the announcement right before the meeting?
I did send another reminder out at approximately 3:30 today, just to remind folks.
Okay. So, so then they got the second reminder, but they didn't necessarily get the initial email. Huh. Well, I'm not sure how to explain that. So fortunately, it sounds like we do have your email, so it is getting out there. And like Stephen was saying, certainly something we can look into is making sure that our email service is up and working, and that everybody's getting it. So maybe we could run a test on it to make sure that it is going out.
Can we suggest, Tom, that
Yeah, sure.
we will be uploading the video. This video is recorded, and then we're also going to provide the presentation in Spanish, the recording on YouTube as well. What we can do is when we post it, I can definitely add Tom's contact information so that if you have any other questions or comments or suggestions about accessing your services, then you can definitely send it to Tom and we can share it with our team. But that is something that we can note, is making sure that we are any way possible, any email, any phone number you give us, that we will try our best to constantly inform everyone that certain meetings are taking place.
Thanks, Sandy. I think that's a really good point. Every town hall, every virtual event that we've conducted, we've been taping them. Folks may have seen or heard. I did a 4-part sort of healthcare in the time of COVID series in town halls, recognizing not everybody could attend for one reason or another, or you may not have heard about it. And these things are on our website. They are available on our YouTube channel, so you could go back and view them at any time. So thank you for mentioning that, Sandy. It's a good point.
And we have another comment that came in. I was prompted to register before I could join the meeting today. Confusing since I already registered. Maybe others have issues joining. I'm not quite sure I understand the question there. So Sandy,
I guess just difficulties joining, like once you get the registration material, that there was a problem joining?
Sounds like it. It came in anonymously, so I can't ask if that person wants to go ahead and type in a follow-up question. We would be more than happy to try to answer that. Next question that I have is there an in-depth meeting we can have with our SCs about services and supports provided by WRC that are funded by WRC? It seems most community recreational programs are relayed through the SCs, but with a bold note that they are not funded by Regional Center.
I mean, at any time you can talk to, certainly you should be able to talk to your service coordinator about different services and supports and ask them. And ideally, I mean, you are trying to identify, like, what are you interested in? Like, for example, I really want to join a swimming program or want to do this, is trying to identify what providers that we have in that. The other thing that I want to mention, that a lot of people have taken advantage of, and that we're currently, we're enrolling new people, is self-determination, which kind of is a new funding model, which allows you to kind of create your own budget and being able to access some services that you want, that might be a little bit more accessible and not having to rely on the vendor process necessarily. The common complaint is that it's very confusing, and there's a lot of learning to be able to choose the right facilitator, create your own budget, access and choose services wisely, and also just understanding the self-determination model. I mean, I myself am often confused and trying to learn it as quickly as I can. But in that and I think the department has recognized, Department of Developmental Services certainly recognized that this is going to be a barrier and a challenge. So we have these folks that I mentioned earlier, the participant choice specialists that families can take advantage of is really, and we're constantly offering, I know Caesar is constantly offering educational sessions on self-determination, and that's another alternative that I would encourage people. In addition, like I mentioned, as far as we have what's called the Family Welcome Experience, and it's an online training, and it explains all the services that Westside Regional Center, like what is independent living support, what is residential, what is social skills, how do I access those services? It's just a complete compendium, a tutorial about all the different types of services. And then that kind of educates you about categories. And then I would have a more in-depth discussion with my service coordinator about specific ones that you might want. Or like, I'm really interested in the social skills program. What kind of social skills programs are available for me? And trying to identify, this is exactly what I'm looking for. These are some of the needs that are not being met, and trying to match that. So we have a lot of options to being able to do that. So our online resource and library to be able to really educate yourself about the types of services, and then having a follow-up discussion with the service coordinator about about specific services that might be available in those categories. And in addition, self-determination is kind of a new model that gives people a lot more flexibility. It kind of reminds me of a difference between like a PPO and an HMO, is that the PPO, you have much more individual choice, as the HMO is kind of more just sort of system driven. And depending on your preference, there's kind of there's pros and cons on each side, but definitely educate yourself about both models. And I would encourage folks to really look at or attend any kind of community education to kind of learn about that different model as well. And realizing that we do have participant choice specialists, that's what the position is called, to really help new families, to educate them and help navigate that service model.
Okay. We've had several questions come in. The next one is, of the 269 families enrolled in the education program, do you know how many of them are using funded services now?
That is a really good question, and I don't know, but it is a really good question. Sandy, I know you regularly look at it. Do you have any idea? Do we have anything metric to capture that?
That's not something that we captured. It's more, our motivational interviewing for service coordinators. We do know that for the 30 that we trained, that each service coordinator did contact 5 low to underserved families that identified as Hispanic or African American or multicultural, and those families did access services. They would have been respite, social skills, independent living, supported living services, residential services, and just accessing resources from Westside. So that may be getting help, parent-to-parent support from our Family Resource Center. It may have been support with their IEP or their school district through our special education advocates.
So the short answer to that question is we don't know, but I certainly hope that a lot of them have once they've kind of become educated. And what Sandy's referencing, I don't know if folks know about motivational interviewing, but we're piloting a new training program for service coordinators. And what motivational interviewing is, it's a special kind of communication skill where you really learn to ask the right questions and really understand what might be some potential barriers or some challenges that families have. Like they may not want to take a service because they don't have transportation, but they're not identifying it. So it's just making sure we ask the right questions, like what are some of the problems, what are some of the challenges, really understanding those barriers, and that kind of helps us to problem solve around those, so that those families that may have perceived barriers, there may be a way that we can bridge the gap. But if we don't know about them, it's hard to know. It's hard to bridge that gap. But so this is a really cool new strategy that we're using in a training model to really help us to engage some of those people that are not using our services.
Our next question actually came in the chat. Where can I
Okay.
read the purchase of service, the POS expenditures for fiscal year 2020 through 2021? Is that something you want to answer, or do you want me to bring Caesar over to talk on that?
So where would you see the data that we're presenting? Like, where would you be able to see the POS data themselves? And Sandy, I believe that's on our website, isn't it? Just our
Yes, it's on our website under transparency.
so you can access that information directly for yourself. And like Sandy said, my email will be in there. So if you, after you go through all the data, if you have other specific questions, feel free to reach out, and I can try to explain it as best I can.
Okay, our next question came in Spanish. Carolyn, did you want to go ahead and read that for us?
Boy, asked and received. Yeah, so our board of director, we have several different subcommittees where we talk about, and these are open to the public, Client Services Committee, Consumer Advisory Committee, or CAC Committee, our Finance Committee, Political Action, Self-Determination, Local Advisory Committee, and also our Strategic Planning Committee. And aptly at the bottom, if you go to our website, we should have those events calendared, and Zoom links available. So if anybody wants to join any of these committees or any of these discussions, certainly encourage folks to come out. And it's also helpful when we hear from the community, because sometimes there's things that we're not thinking about or we're not aware of. And so this should be you kind of informing us. Good question. I don't know. I don't have a good answer for you. And they should be, the minutes should be translated. That's a great idea, and certainly something that I will get relayed back to the board. Something that we would consider is that we have those minutes available in Spanish and English. And one of the things that I just say in general, I'm very grateful about, is the Department of Developmental Services has indicated that they're going to provide additional funding, recognizing some of the disparity needs that we have for us, specifically in the area of translation. And so that's certainly something I'd be looking at, is what materials we have currently that are not translated, and trying to ensure. And so this is a great point, is that these committee minutes, anything that we have that's kind of coming from any type of public meeting, ideally everything we have is translated in Spanish. So that's very good feedback. Thank you.
Okay, next question. It seems like we're assuming that Spanish-speaking families are comfortable with using modern technology. Why are we assuming that?
Well, we're not assuming that, and that's why we, like I had said before, we partnered with the provider Empower Tech, understanding that some people either would not have the devices, would not have the understanding, or would not have the information, so that we could provide them ideally with the device, and also with support to be able to kind of navigate and use that device, because we absolutely recognize that a lot of families are not entirely comfortable with technology or with new technology. But it's certainly something, more and more, I think, it's something that we're going to have to come to terms with, especially recognizing post-pandemic, a lot of information, a lot of resources, a lot of services and supports is happening virtually. And realizing that there's sort of a broadening gap between the haves and the have-nots, because those that are really comfortable with technology are going to have a lot more information and a lot more access to a lot of services that are currently happening virtually. And I think in recognition of that, certainly something I think we're committed to is, that's why we're developing a lending library. That's why we've developed a provider that would be able to support folks, is trying to help those that are kind of that are beyond the learning curve on that and need some help and support to try to catch up, because that is absolutely a problem. It's something that we realize that we need to help folks catch up on, because right now, I mean, the truth is it's kind of hard not to choose not to go online, because so much is available online, and if we can help you to get online and to get comfortable with it, then I think that would be a win for everybody. But thank you for that question.
Thank you, Dr. Kelly. Our next question came in the chat. How many cents does Westside Regional spend on Latinx individuals for every dollar it spends on white individuals?
I'm sorry, Stephen, could you repeat that? I just didn't.
How many cents does Westside Regional spend? I apologize. I'm getting tongue-tied here. How many cents does Westside Regional Center spend on Latinx individuals for every dollar it spends on white individuals?
Boy, I'd have to do some serious math there. We have like a dollar amount per capita per individual. So we broken that down. You can look on the previous slide. It really kind of shows how much we spend on each ethnic group. So you can compare per individual about how much we're averaging per individual in Caucasian, in Hispanic, in African American, in Pacific Islander, Native American. You can see kind of all these groups and really compare. And like we mentioned before, so all of this data, that I'm presenting, the purchase of service data, that's on our transparency page on Westside Regional Center, so you can go on and look at it for yourself and kind of look at the numbers. And if you want to break it down to dollars and cents, you could do that as well. My math skills, to be honest, I mean, I was an English major for good reason, because my math skills were not the best.
And our next question came in Spanish. Carolyn, if you want to go ahead and read that for us.
So I'm not sure the question. So the question is, I'm trying to understand it, and please clarify in the chat if I'm not speaking to it. So the feeling is that the service coordinators are not making it easy to understand and access services, and why does it seem like there's more barriers or challenges, particularly for Hispanic families, in being able to kind of understand and access? Does that sound right? Is that the question? Okay. Well, it's sort of multiple reasons, that we talked about, and is for one, we have a lot of service coordinators that have burgeoning or very large caseloads, and so kind of what are we going to do about that is trying to ensure we're trying to hire a lot of new people, so we have more service coordinators, so that kind of reduces their the number of cases they have. In addition, there's a recognition. We can look at the statistics, and I presented them before, where there's a number of people that are receiving little to no services, and we recognize those particularly represented, largest group that receives little or no case managements in Westside and statewide, Hispanic families. So fortunately, I mean, the department has recognized that and understands that. So what we have, and they're called enhanced case management. Basically what that is these are service coordinators that have a reduced caseload. So whereas normally the expectation is that they would support, one service coordinator for 62 families, for example, these service coordinators would be one service coordinator for 40 families. So they would be able to provide a lot more individualized attention to those folks that we've identified that don't have, that really are receiving little to no. Some of the other things we realize is that, depending on the service coordinator, we have a lot of service coordinators. Quite honestly, they're going to be new freshman service coordinators. So they're learning. They know what they know and they don't know, and trying to level the playing field. That's why we're doing a lot of online trainings to really, in case it's not explained to you, all the different services that we have, so that, in your hands, you have kind of the menu. You can't order if you don't have the menu. So we're trying to provide that menu, and that's the family welcome experience. The other thing that I think we're really committed to is is training. It's really trying to ensure that all the service coordinators are well trained in all the different services, and not just the services that we offer, but how to communicate to families. Because we can sometimes, if you're depending or waiting for a family to ask questions, we may not be providing the right questions, the right answers. So we have to not only we have to be able to anticipate some of the questions and start off with a real education, giving all the information, giving all the resources up front, and then allowing people to ask questions, because then they'll be in a better position to ask us what specific questions they have about specific services they may not even have known about. So it's a number of things: enhanced case managers, having reduced caseloads, trying to hire a lot more people. So in general, we have more individualized attention. And the other thing is really training our community, trying to provide as much educational and much information as we can about our services to the community so that you're informed and can ask the right questions. And also teaching our service coordinators to be able to ask the right questions and in the right manner so that we have good dialogue and good communication. That's a great question, though. That is a tough one, and it's a good question. Thank you.
Our next question that came in: it seems important to keep track of what is working and not, and report back to us. Who will do that?
Well, Stephen, you could probably speak to this. What's working and what's not working. I mean, I think a model that we're looking at, person-centered thinking in general, is, and that's a key skill in person-centered thinking. And we're constantly looking at that. What's working, what's not working. But the other part of the question, and I think this is a valuable question, is where's the accountability? Like how do we know? So, for example, today we've talked a lot about different things that we're doing. We've given you the statistics. We've given you how many people are not receiving services. You can see some of the different disparities for yourself. You can look on our website also and look at the data yourself, so you can see where the holes are. And we're certainly aware of it. We've also gotten feedback that this is an area of need. And the accountability right now, I mean, the one thing that we have set up is this meeting is, so I've presented, these are all the barriers and this is what we're doing about it. And so every year we're kind of looking at that and saying, well, where are we? And quite honestly, we've not advanced near as far as I would have liked to. So I think there is a recognition, like we need to do better. Like there's got to be something that we can do. There's also, we talked about some of the committees, our strategic planning committee. Certainly something we're looking at there is we have a strategic plan, and disparity is really one of the critical areas that we've identified in a strategic plan. And we've had formed a number of different work groups that have targeted some of these questions around disparity. And this committee is going to be where we're basically reporting back. We're reporting to the board, which is representing the community, and we're saying, this is what we've done, and and built into that is some way to kind of measure efficacy. So we're really trying to look: is it working? Is it not working? And looking at and building in sort of ways to test ourselves. But that's another good question. So I really appreciate that, and that's what I've got for you. I think that it's something that we need to continue to work on, but hopefully now that we have a strategic plan, and I certainly encourage folks, we talked about committees, attend that committee, because we built this strategic plan on input from the community and also from a diverse community. So we really wanted to hear from the Hispanic community, African American, Pacific Islander, Asian American. We got a diverse, we've heard from service providers, from families, from individuals that we support, from staff. Everybody had something to say about it, and we took that all and we put it into a strategic plan. And diversity is one of the big things that we recognize is an area that and a strategic plan is basically, what is this organization? What is our direction? What do we need to develop over the next 3 years? And disparity is, like I said, really a big issue that we need to look at. So thanks for that question.
Our next two questions actually came in Spanish. Did you want to go ahead and take that, Carolyn?
So what I brought up before that we're hiring, and that's another great question. So Department of Developmental Services has recognized that this is a barrier, and that it's a very difficult system to understand and navigate. So what we've hired is, and they're called participant choice specialists. So, and they're there not only for families that have questions, but they're also there for service coordinators that may have questions or may not understand. So now, ideally, what should be happening, instead of referring you to our website or to to read something, is that we can refer you to a person who is very well informed about self-determination and can help answer individual questions that folks may have. Certainly, this is something that I think everybody's aware of. Department of Developmental Services certainly realizes it because they've added these positions to every regional center. Is that we so that we have these individuals on board so that service coordinators can access them, families can access them to really help you to understand what this model looks like and to answer the specific questions. So we do have individuals. You don't have to just go to the website. You can ask to speak to or consult with our participant choice specialists.
Okay, our next question is, we, the Ethiopian community, are struggling to reach out and create support to ourselves to get together and address the resources and disparity of services. Is there extra way or resource to address this? Translation is also a big problem. Our language is not developed like English, so it needs more than Google Translation to exactly do the job. We need cultural sensitive and multilingual caseworkers.
Well, as far as like developing a community, I mean, and different support groups, Family Resource Center has been a real helpful advocate in trying to help bring individuals together. They've helped, and I believe, I don't know, there is an Ethiopian support group, I believe. So hopefully, you're aware of that. And so the Family Resource Center, and if there's additional supports that are needed, certainly your point is well made. Is trying to hire as much diversity as possible, and it's certainly something that we've looked at and included in our strategic plan around disparity. Is really trying to look at the ethnic makeup of our staff and ensure that it matches and it mirrors our community statistics, and that we have a diverse staff that would be able to kind of match those needs specifically. We should be, ideally that, and now I'm glad to hear that we're getting additional funding towards translation to be able to translate materials, in different languages, so that whatever material we're giving to you, ideally would also be able to you'd be able to access in your native language, and not just using Google Translate, which I have used and I understand is imperfect. So I think that's a very good point. I do direct you to the Family Resource Center as far as connecting with support groups, or even helping to connect to a community of other individuals that may be looking for that same connection.
And I apologize, there was a follow-up to that question. I, as a parent, also want more supporting personal resources to parents to make them stronger.
Yeah, again, I think that's what happens in, for example, I know Siempre Amigas, it's a real popular Hispanic support group that we have, and that's been ongoing. So it's like parents helping parents, and I think that they do a lot of, getting together as a group and then really trying to help inform others. But I think your point is, certainly like kind of helping to mentor other families, helping to connect with other families. We don't have like an actual promotora model operating at Westside, but I know that there's funding that hopefully we'll be able to access. So I think that's a great idea. I mean, I think going forward it'd be good.
Our next question is actually in Spanish. Carolyn, did you want to take this one?
We do, actually. We have for 0 to 3, for 3 to 22, and for 22 and older, we have resource booklets that specifically outline all the services that we offer for those individuals. Sandy, can you help me out? We have that probably online, but we also have actual booklets that service coordinators can provide to families.
Yes, that is true. So I did put on the chat box a link for our resource page. So our research page will also have all of the publications that we offer. So I'm going to share my screen really quick. So if you click on that link I share in the chat box, it's called Resources. It's available in English and Spanish. So you can download services and supports by age range. So 0 to 3, 3 to 10, 11, 17, 18 to 22, 23 and older. We have the brochure for Family Resource Center intake. We have other publications about diagnosis, our information and resource booklet that talks about the regional center, how to access services, the role and expectations of the regional center. If you have a child that's in high school that will be transitioning soon to community life, we have a booklet there as well. And for early start families, we have a booklet for families as well and caregivers of children enrolled in the early start program. Flyers for all our support groups are here. Information about special education advocacy, and just our large list of resources in the community. So you can look at the categories on the very far left. And that's all on our website. If you were to click directly on our website, you can click here on resources or up here on resources as well.
Our next question actually came in Spanish again. Carolyn?
Like educational advocates? Yeah, okay. So actually we have 3 educational advocates, but it's not quite enough. Because certainly realizing, especially lately, especially during COVID and post-COVID, and I actually spoke with one of our educational advocates today, who was speaking about overwhelming amount of need for advocacy. Ideally the hope is too that service coordinators, once we can, we hire enough and we have lower caseload ratios. One of the things that I brought up is to be able to attend IEPs to help out with advocacy. Once upon a time, it's something that we had done more of, and now with this, we have with the caseloads that we have. I recognize for service coordinators it's been much more difficult. But the idea now with much more focused, intensive case management opportunities and options with better caseload ratios, service coordinators can also help with that. I certainly hear that because I think schools have definitely suffered during the pandemic. I've heard from the educational advocate today that we're not getting a lot of the services and supports are not being funded. They don't, because school doesn't have the same staffing that it did. It's lost a lot of staffing, and especially a lot of its specialized staffing, and so a lot of the IEP needs of students are not being met or addressed adequately. And this is certainly something that we recognize. I think, I don't have a really good answer for you other than something that I would bring back to our team. Things that we have done, in the past is we've had community meetings with SELPAs, or the different districts and district representatives. And maybe what I would offer or suggest to the educator is we could do town halls to kind of address some of the common questions that we have from the community around educational issues and not getting educational needs met, and hear from different district representatives what they're doing to address these problems. Because certainly recognition that this has been a problem these last 2-3 years, it's really overwhelming. And you're right, we don't really have enough resources to address it.
And our next question again came in Spanish.
Well, I'd have to agree to disagree. I don't think that service coordinators are trained just to deny a service. it's certainly not any job. I mean, if that were the case, I don't think anybody would want to do that job. They're actually trained to try to accommodate service requests as best as possible. That being said, there is a recognition. We have what are called service standards, which give us specific parameters dictated by the state, dictated by welfare institution codes that we have to operate within. So there's, I think I don't have any service coordinator I talk to. I think that, if they could just actually approve any service, I think they would be more than happy to do that. It's certainly much easier to approve a service than it is to deny a service. And so I don't think that they're trained to deny a service. It could certainly feel like it. I understand, especially if you have a specific need and it's denied. It can certainly feel like that. As far as the appeal process, it is a legal process. We do have information, by the way. We do have a recording about the appeal process and what it looks like, and it's on our website, and it's on our YouTube channel. We have a YouTube really informing exactly what an appeal looks like. It's not as daunting or as it seems. You basically just make we have to, if we deny a service, we have to make we have to notify you in writing within 30 days. And then you have the right, you get information about how to appeal. The appeal, basically you sign, I don't agree, you give it back to us. And then it goes to like a mediation normally. So we will have one of our fair hearing coordinators and meet with families, discuss the service request. And then what we try to do is we try to kind of meet in the middle. And thank you. And Sandy has put up learning about the appeal process and fair hearing request in our chat box so that you can access that. But sometimes through mediation, informal mediation, before we even go to a formal hearing, we can sometimes kind of negotiate and figure out, because we look at ourselves and in informal, once it gets there, the fair hearing person is kind of an arbiter who's just looking at it going, yeah, was that fair? Was that the right decision? And is kind of questioning us on it. So we kind of do a back and forth. Sometimes we might come up with another service option, or sometimes we might just agree with the service. Worst case scenario, it goes to a fair hearing. And all a fair hearing is, it's in, now I guess it's on Zoom. So you would show up on Zoom. There is a judge. There is kind of a formal process. The judges that I've worked with are very family friendly. And if I had to say, I think that they're probably more family friendly than the regional center. I haven't been on the other side of it. I think that they're trying. They understand that you're not an attorney, or you're not there. So they try as much as they can to try to explain as you go. But what you do is you basically say, this is what I want. This is the service request that I made. And then on our side, we explain why we denied the service. And then what the judge does is he looks at the law to make sure that we're following our own statutes. Because we do have, it's called the Welfare and Institutions Code. We are limited within the statutes about what we can approve and what we can deny. And, more times than not, the judge will look at it and say, you know what, folks at the regional center, that wasn't a fair denial. It kind of goes both ways, but they basically, there is something looking over it. I would also say that we have clients' rights advocacy in our building is there to support families. And, so if you really feel like, we haven't been fair to you, or you haven't, been listening to your needs, or feel that a request was unfairly denied, there is, they can offer at least legal counsel and support to kind of help families. So there is a bunch of options out there. And I also encourage that what we put in the chat, take a look at yourself. About the appeal process. I think it is very good to educate everybody about. So, but I don't think that the service coordinators, I don't think they want, nor are they trained to just deny a service. They're actually taught how to approve services typically.
Tom, do you want to mention that we are currently creating a online training system for new employees, and we're creating all these videos to teach new service coordinators about all the generic resources, about service and support. So essentially, we don't want any family that possibly has a new service coordinator out of the 16 that we're hiring, that we are making sure we are making strides, that they are going to be trained, that they are going to be prepared to assist families.
And if you're wondering out there in the community, who is the Sandy person who keeps chiming in? Actually, Sandy is our cultural and disparity specialist. So she's been involved in a lot of town halls, a lot of different community forums, has heard from different family members about issues around disparity, and so is really helping to inform us of what are some issues and what are those. But Sandy, to your point, and I think I had brought it up before, kind of I talked about leveling the playing field, is we have some service coordinators who are veterans who know, like the encyclopedia, they're an encyclopedia of information about resources. And then there's relatively new people. So the same resources that we're offering to educate families, we're also offering to educate, service coordinators, so that they're also seeing the same information, so that we make sure that they have all the different information as families do. So thank you, Sandy. Thanks for bringing that in. I don't know. I think the webinar, it's easier. My understanding, and I'm also I'm one of the people still learning technology, is it's just easier when you have a much larger group. It's easier. Zoom is better when you have a smaller group, but webinar, typically when we have to do, like, for example, translation, or we have to do questions, or we have to do a PowerPoint, and we kind of have to do all these things with a large group, we typically rely on webinar. But I agree, like Zoom is a more intimate forum, and I think most of the committees that we have, like the board committees and that, are on Zoom. They're not webinar, and that's where it allows for a lot more discussion and kind of a little bit more intimate. But that's my understanding. I don't know, Stephen or Sandy, if you have anything different that you'd add, because you guys are much more professional with different versions of Zoom.
We are currently on Zoom. We're just utilizing the webinar format in Zoom. The reason that we are using the webinar format is because we can access all the different functionalities of Zoom by using webinar format. In a meeting format, we wouldn't be able to utilize everything that we have at our hand. And the next question is, can you please share how many attendees we have present for today's meeting? Currently, we have 25 online. We had a few more. I didn't get the top total, but currently we have 25 attendees right now. Next question is, could you please link to your social media pages in the chat? I believe Sandy has been doing that. Sandy, you've added social media in the chat, correct?
Just the website, but I can certainly, if you can give me a second, so I can do the translation as well. I will give the link for our social media.
And while you're doing that, do you want me to go ahead and ask the next question?
Yes, please.
Okay, Carolyn, the next question is actually in Spanish.
Well, I guess my question back would be, so it sounds like what you're saying is if you can't even access the service coordinator, how are you going to access the different resources that the service coordinator can have? And the answer there, you should, if during the work week, you should expect, if you call or email a service coordinator, that at least within 2 working days, you should be receiving a response. If you don't, and you're not getting a response, every service coordinator has a manager. So you could reach out to the manager. If for some reason the manager is not available, or you can't, you can call our reception. Our general number is 4000, and you can talk to a counselor of the day, and state whatever your concern is, and explain that you're not able to get a hold of your service coordinator, and then that person will kind of help connect you. Or if for some reason we can't, is try to figure out why your needs are not being responded to.
Okay, and our next question was, are you working with parent groups in the community who can help other parents learn about the regional center?
Yeah, we have interface with a lot of different parent groups. Like I mentioned before, we've interfaced with Siempre Amiga, the African American support group, but also we have a grant project. We work with our USAID. We have like a community partners with the Achievable, which is a federally qualified health center. So we have a lot of different community networks that we're working with. But could I think the more, what I would certainly encourage, and I mentioned it before, we have a strategic planning committee, and we have heard from committee members of those various groups that I mentioned at that, when we were designing and developing our strategic plan. But the more now what we're doing is we're in implementation phase, is really trying to, this is where the rubber meets the road, is that we're trying to really implement our strategic plan. And I think way back a question was asked, like, how do we know, what's working, what's not working? That's where we're really evaluating those questions. And we're also trying to get active feedback from the community about what's working and what's not working. I would encourage those groups to attend that. And we regularly will try to do community town halls, feedback sessions, trying to get community input. So, if you could, and if there's any group that we're not networking with, I'd love to know what group you're representing, and I can try to put my email, or Sandy, is my email in the chat on this? I think you already mentioned it was. So please email me if you've got like a specific group that maybe we're not in contact with or hasn't heard from us. I would love to know who they are so we can include them in that network.
Okay, we had a question come in the chat. The data on the annual expenditure report shows that Westside Regional spends on Latinx individuals about 50% less than on white individuals. What is the plan to fix that?
Well, I think it's everything we've talked about here. So for those that have little to no POS, which we recognize that the Hispanic community is overrepresented in that group, is that we have specialist enhanced case managers who are going to be working specifically with those families, because we recognize a lot of the families that contribute to this statistic are like I said, overrepresented in the Hispanic community. So that's a key thing. The other thing is just really trying, like training, educating our families, educating our service coordinators, developing a service coordination training platform that teaches them how to engage with families that may have barriers to accessing services, and then including that's all included in our strategic plan, and what we're reporting to it is looking and hopefully trying to see moving the needle. The other thing that we realize is a lot of folks in our Hispanic community, some of the services that they've asked for and wanted that we have not traditionally been able to offer. Now there's an understanding that like social recreation programs, camp programs, tutoring, after school support, things like that. Now we have the ability with the legislation that was passed in July that we can incorporate those services. So I'm really hoping that people take advantage of that. And we're trying to, the other thing, but recognizing is we need a lot more social recreation vendors, particularly in those communities that serve Hispanic families, so that they're, within their community, they have that. All of that being said, if they're not, the other thing that I recommend to people, if they really feel like they're not able, using the traditional service model, they can't access the services they need, is learning about self-determination. And like I'd also mentioned, we have participant choice specialists that are trained in self-determination to work with your service coordinator, to work with you, to really help explain the model and try to see if this would be a good fit for you or your family. So all of those things that we're trying to incorporate but certainly there's a recognition that there's a disparity, not only with Westside Regional Center, but statewide. I mean, this is an issue, and I think the Department of Developmental Services recognizes, state legislature, and so fortunately there's been a lot of, we've got a lot of additional resources devoted to looking at this problem. Now the question is going to be, whether it works or not.
Okay. Our next question is, we, the Ethiopian community, have a strong support group under the Family Resource Center. People who run the group are doing a magnificent job bringing WRC resources and parents together. But I think we need more in volume and numbers to bring parents who are living in an island and way far from the needed resources because of language barrier, academic background, and cultural sensitivity. We need more resources to go to our community and address the need of working together in disparity. My second question is more focused on finding resources to parents who, I have to scroll down, who funding resources to help parents get out of the hardship once in a while to gather themselves, like yoga or working with hotels and recreation places to go to regroup themselves.
It makes me think, as far as connecting, and Sandy, maybe you can speak to this on our website. Do we have links to different support groups that are currently, so that we can make families aware of the different community support groups that we have that are already in existence?
Mm-hmm. Yes, I can share the link on the chat box.
I think what we could do in that respect, and I love the fact, the support groups that we have been phenomenal, and at really, it's families educating families and supporting families. I think it's a great way to go. But we could certainly try to help. I think what we're doing is like informing folks, trying to figure out outreach methods so that we can reach out to the community and kind of inform them of these existing groups, because there's probably a lot of families that don't know about the Ethiopian support group, don't know about these different the groups that are in existence where they would really benefit. So I certainly encourage you, if you have any outreach materials that you use, to share it with us, and certainly we would on our end is try to brainstorm about how we might be able to do a better job with outreach and sharing with the community. And there's another part of that question. I was kind of focused on that one.
And if I can add, Tom.
Yeah, please go.
That Stephen mentioned that if you are signed up for a newsletter, that he does include information twice a month about all the support groups and what the times that they're meeting, a link to their flyer, and also when to join. And also I try my best to promote these support groups on our social media as well.
And I now remember the second part was just talking about resources for families. That one's a little bit more difficult. Usually most of the services that we have are to benefit the individual, so we have to be really creative about how we extend those. I certainly think that care for oneself, is going to help to care for family members. I think where you could probably find different opportunities for recreational activities, probably in these support groups. I know people have shared resources in these groups, like different, you kind of find out, like you can yoga, there's different places you can go do yoga for like very inexpensively for donation. I would, I don't know if folks know, but there's I also shared a lot. One of the things that we recognized is a real caregiver burnout during the pandemic. For individuals 55 and older, SCAN, I don't know if folks know about this, but SCAN, which is a large Medicare company, they have a nonprofit wing which offers free therapy. I think now it's Zoom therapy. It used to be in home therapy, but for individuals 55 and older, there's free therapy. You're eligible for free therapy. And if anybody wanted to take advantage of that, all I would need is their name, their contact information, how to get hold of you, address, and date of birth, and I could refer that individual to that program. So we have a whole bunch of different, monthly support groups, and Sandy's putting that in the chat as well as like different support groups.
Okay, the next question was, is this person going to provide the trainings? Sandy, do you want to take that one?
Like myself providing trainings? Well, I will say that if you want to learn about all the resources that we offer through Westside Regional Center, through our Family Resource Center, or any resources in the community, I do encourage everyone to sign up for the Family Welcome Experience. I did put a link to the flyer in the chat box if you scroll upward. It has videos about all of these topics. Um, it will inform you about all the booklets we have, all the resources, all the flyers. And you'll just watch videos. We do have program managers, we have our ed advocates that provide an abundance of information, as well as any recorded webinar that we do. It does go up to the Family Welcome Experience. So every month that that training library is continuously updated with information. So if you need a way to just watch a video and learn about these resources, I do encourage you to sign up for the Family Welcome Experience online course. So there is some that, as Tom mentioned, for early start families, so birth to 3, or school age youth, and also for our adults 23 and over. So it all caters. So if you want to learn about certain services and supports, if you want to learn about how to ask for that service through your service coordinator, we do have program managers that gives you steps about how to contact your service coordinator and what information you should start gathering when you're asking for that service.
Okay.
Next question is, wow, 25 sounds so low for how big WRC is. Are we going to have another meeting so more people can attend and ask questions live?
We weren't planning on it. If there's, I certainly something that we could offer. If there's, so I'll talk with the team, and if you feel like there's a lot of people that may want that, sure, we could do it. We don't have anything on the books, but I'm certainly willing to answer more questions.
Our next question is, when will the training start and can parents participate? I'm assuming you're talking about the trainings that Sandy mentioned earlier, about staff trainings. Sandy, did you want to speak on that?
Yeah, so I was just going to show everyone what it kind of looks like. So this is an example of their course for early start program. So essentially anyone can sign up. You do not have to be a family member or someone served by our regional center. We do share this information with community partners as well. For example, the Children's Hospital Los Angeles is actually using some of our courses to train their providers, their psychologists, their staff. So that's just an example of how our courses are being utilized by other agencies. So this is kind of what the early start program course looks like. So you would register through the flyer, the link on the flyer, then you'll be signed up. It will look like this. It just kind of gives you understanding of what you should be working on. It gives information about joining us on social media, subscribing to our newsletter, visiting our website in case families are not aware that we have social media or website. Then families can start to navigate. So if they want to, well, I can't share with this one, but essentially if families want to learn about a certain topic, they can go through that course, and what you can do is learn about the early start program. We can learn about what you should expect from your service coordinator, what they expect from you. It talks about the transition process starting at 27 months of age. We also have bonus material that sort of tells you about preschool inclusion for these family members. Everything will look different if you're in school age category or range. Then we'll talk about the school district. I'll give you information from our ed advocates about how to hold a successful IEP meeting. It will inform you about your rights, your responsibilities. If your child is transitioning from high school to adulthood, it will talk about how to assist your adolescent to prepare for living on their own, for college, for work, for internships, anything like that. And it tells you about all these services. So for early start, it will tell you about therapy, so speech therapy, feeding therapy, all that kind of stuff. So it's really, really informative. I do suggest families that please use that flyer I shared to look up for this information. If for some reason, for example, you don't have the flyer, all you have to do is go on our website, go here where it says services. So select whatever range your child is. Let's say your child is between the ages of 3 to 10. As you scroll down, you'll know this is the brochure, for example, of all the services and supports, or majority of services supports are available to your child. It's English and Spanish. And then as you scroll down, I'll tell you about the online training course. So what you can do here is click on the link, and then you would just have to fill out information to enroll in the course. So this is just information that we collect to enroll you. We want to kind of, for funding purposes, in case in the future, for example, there was a parent that mentioned, I want this information in a language other than English and Spanish. Then this information will help us inform the Department of Developmental Service to let them know that, there is interest in other languages. Can you please provide future funding so that we can have interpreters, who can have experts create the content in a different language for these family members. And so that is the importance of filling out all this information so that we can share with DDS that, we have an idea of a grant. There is a number of family that really wants this in different languages. And this is evidence or in data that shows that there is a need for this type of service. And so this information we'll share with that department, and they'll note down, oh, okay, there's a family member that really wants this information. It's just not accessible right now. We're going to give Westside Regional Center funding to conduct a project that would translate all this content into various languages.
I'm going to jump down there. A question just came in literally about that, and I think you just answered it. The question was, what other languages is this available in? And you said that it's going to be available in multiple languages. So I think you've answered that question.
Yeah, so for now, in English right now, we will finalize the Spanish version by the end of April, maybe sooner. And then that will only be available in English and Spanish. As people start to fill out and mention that, I want this in a different language, then we can use that information to ask for funding from the Department of Developmental Services and let them know that there is a great need in a specific language and that we want funding in order to make that happen.
Okay. And our next question is in Spanish. Carolyn, did you want to take this one?
So like I'd mentioned, every coordinator has a manager, and if you're, not able to get a hold of that person, you're repeatedly trying, or you really feel like you're having difficulty communicating with that individual, then you could certainly ask to speak to. It's basically you're asking to speak to the manager, and kind of letting the manager know about issues that you've had and trying to kind of work it out at that level. But I would certainly. And if you can't reach the service coordinator, you don't know who the manager is, you can talk to, you can call the receptionist, and they should be able to direct you to that manager. Just tell them what the service coordinator's name is, and we can look at the unit and then connect you with the unit manager.
Okay. And our next question is, are you conducting any sort of outreach to let people know they can get social rec again?
Yeah, we mentioned the newsletter. We've also done, we have it on social media. We have it on our Facebook, our website, and I believe we sent out information. What you saw, the flyer that we saw earlier that we referenced in our slide. We sent that out to families and to providers, and also to the service coordinators. So you should have received that same flyer, because we're trying to recruit as many people as we can. But so yes, we are reaching out and trying to inform families about this, and also trying to get help in recruiting new providers that families may be interested in using.
Okay. And the last question was, how are you reaching out to communities? I think that you just answered that, but if you want to speak on that more, go ahead.
Well, it's a variety of different resources. Stephen had mentioned we have a newsletter that goes out. We also speak at different support groups, and we certainly let them know the information. We have the Family Resource Empowerment Center that provides information to different families and different support groups. We have, at times we'll do email blasts, and, and constantly posting things on our website and social media sites.
And that's all the questions that we had in the question and answer. Carolyn, if you scroll up, there was one question that I believe we missed in Spanish. Can you see that one?
Well, I can't speak specifically to the hiring practices because I'm not in human resources. But I had spoken to one of the individuals in the Family Resource Center, and this has been something. We have different people. I mean, part of the problem is you have a number of different people that are manning the switchboard, and some of the folks that have manned the switchboard, that do man the switchboard, are bilingual, but not all of them. It's true, so what we use is we have the Family Resource Center that will help, and we'll connect those families with the Family Resource Center. So, but why we hiring practices, I think we can't specify that only bilingual people can apply. We could put it down as a preference, something that we prefer, and it certainly helps. But specifically, since, as you mentioned, we have a predominant Hispanic community. I can't speak to the hiring practice, but I do know that we have additional supports in place to be able to answer questions for folks in Spanish.
I am muted. Thank you, Carolyn. I see no more questions in the chat and no more questions in the Q&A. I don't see any hands raised at this point. Any last comments, Dr. Kelly?
Well, the last thing was raised about possibly having another meeting, or if other people had questions. My email is in the chat. This will be so you could if you have any questions that come to you after this, or you have other people that may have questions, you can certainly forward them to me. I'm more than willing to reach out and try to answer individual questions. Also, this presentation is recorded, and you can access it in English and Spanish on our YouTube channel, right, Sandy? On YouTube, our YouTube channel, and you can get the link on the website.
Yes.
So this will be available. So if somebody wasn't able to attend, they can come back and look at it.
It looks like we did have a question that just came in Spanish.
Well, I mean, what we do is you can ask for someone who speaks Spanish, and your call is transferred to a Spanish-speaking. We do have a number of people at the agency that are Spanish-speaking, so we can transfer that call to somebody that will speak Spanish.
Okay, it looks like we have no unanswered questions at this point. Nothing more in the chat, and looks like one more thing came in.
That they have not been able to transfer to the reception? I mean, to a Spanish speaker? Okay. Well, it's something that I will bring up with the team. I don't know why. I spoke to somebody today who said that she's received a lot of the calls that have been transferred. So it sounds like we do have people in place that are for that purpose. But so I'll inquire. I don't have an answer. She's right.
I guess again, there's nothing more in the chat or in the Q&A. So thank you all. Any final comments, Dr. Kelly or Sandy?
Just
Okay.
that I've been taking notes. So I do many things at Westside Regional Center. I think many people can attest to that. So I do have some control over the website. So what I can do is sort of rearrange it. I did notice in the chat box that some family members or just individuals had trouble signing up for the orientation or part 1 for the self-determination program. So what I can do is try to figure out a way so that it's not confusing and they can find that information right away. So it may even be just creating 2 separate pages, one for information about self-determination, and the second page could be about how to register for their orientation and next steps. If that is something that would increase our access to self-determination program, that's something I definitely can do myself and address that issue.
Thanks,
Thank you,
Sandy.
Sandy.
Well, I want to thank everybody for attending and staying through the whole time. I really do appreciate the questions. A lot of really good questions and very thought-provoking. I do encourage everybody to attend, particularly our strategic planning committee meeting. I think that's a good place for us all to kind of group think things that somebody said very aptly, what's working and what's not working, and really to kind of evaluate and kind of for all of us to inform one another about things that we could do better. Because certainly the recognition is we could do better. And, I certainly say that. I don't, the issue around disparity has been a statewide issue for a number of years. And, and I really like to see that change happen. And so I think we need to, as a community, to get together to make that change happen. So I really appreciate your time, your attendance, your questions, your thoughtful questions. And Stephen and Sandy and our interpreters, thanks, guys. You guys are invaluable. I really appreciate everybody. So thank you. And good night, everybody.